You have met with a team of experts at the Spine Center at Beth Israel Deaconess Medical Center, and you have decided together to treat your pain with a spinal injection. You will have been provided a personalized spinal injection appointment sheet with instructions on how to prepare for your procedure. It is critical to follow these instructions. You may refer to both the appointment sheet and the Preparing for Your Injection patient education packet provided to you.
We want to make sure they're not taking any blood thinners, like Coumadin or Plavix or things, extra aspirin. We want to make sure they're not taking any antibiotics for any infections, because those would be contraindicated in doing an injection. We also want to make sure if they're diabetic, are they well controlled, because sometimes the steroid we use can increase blood sugars.
A lot of dietary supplements can actually cause bleeding. So when we're doing injections, that's something that we're concerned about, because any bleeding that can occur within the spine or beneath the skin can actually be a serious complication.
There are situations we may cancel or postpone injections, primarily because of two reasons. One is ongoing infection, because we don't want to spread the infection to the deep spine structures. The second reason is patient on blood thinners, so that increase their risk of bleeding in sites where we cannot compress on.
As long as you are not sick or pregnant and you follow your pre-treatment instructions, you'll be set to go. Also, remember, you need to let us know if you have had a change in your medical condition that requires you to start taking a new medicine. If you have taken any kind of steroid or you have had a recent surgery, those are the other reasons to check in with us.
The greatest fear is fear of the unknown. So we try to make sure through your initial visit and any follow-up visits before a procedure that the doctor really takes the time to go over, this is where you're at right now with your condition, this is what we want to do, this is how we're going to do it, and this is how we hope to where we hope to get you at the end of that procedure.
One of the things I do emphasize to the patient is that there is no unknowns when we are doing the injection, that we will describe and inform them of every step that we're using, and they will have control to stop me if we are proceeding with anything that's making them really uncomfortable.
Another common concern is just that people don't like needles, and that's very, very natural. What we do in those circumstances, of course, is we explain to patients that we're very careful to get them very well numbed up. So we use lidocaine. It's like the Novocaine that your dentist uses.
We try to work with them also, first and foremost, to try to calm down their fear. But some of them may need a little sedation regardless. Then usually it's an intravenous, where we will put a little bit of midazolam and fentanyl if needed. This is less or just about as much as what you would get when you get a colonoscopy. For that particular case, then you need to be fasting 6 hours before coming in, and you need to have somebody to escort you home.
All of our nurses have literally decades of experience between them. So they know a lot about pain medicine, they know a lot about the procedures that we do, and the course of treatment that most of our patients go through. They reach out to patients via phone, and now also via patient site on the internet. So they're available to patients quite frequently, and they can be extremely helpful.
Most injections require you to have someone who can take you home after the procedure. No driving yourself, and no cabs or Uber. Plan on wearing loose-fitting clothing and leaving any valuables like your cell phone, cash, and jewelry at home. If you have any questions leading up to your injection date, don't hesitate to call or email.